Good day, I'm Nika Anderson-Isaacs, Communications Officer within the Ministry of Health, Wellness and the Environment. Today we'll be doing key interviews with persons represented at the OECS Multi-Country Strategic Response training towards the reduction and elimination of HIV, AIDS and tuberculosis. Stay tuned for so much more in this section with us. So we're here with the lovely Dr. Josey Davy, and you are the Registrar responsible for infectious disease and also the Clinical Care Coordinator for HIV. Now we're at a 2-day workshop that is looking at a multi-country strategic response. How important do you think is this for St. Vincent and our ability, the ability or the wing that it would give us to do more in terms of control and eventually elimination?
Great. Well, essentially, this 2-day workshop or meeting is meant to help us to understand how we can spend the funds available to us. So it's more of rolling out the plans that we have made and putting a budget to everything. Everything begins with planning. And then when the planning of the activities are rolled out, then of course we can do good work.
Okay, so this meeting you would say is important because it gives us the resources to execute the plans that we have, right?
Correct.
From an infectious diseases standpoint, what does this mean for St. Vincent and the Grenadines?
It means that we get to continue treating our patients well because funds are available. The resources that are needed to treat persons, especially with HIV and TB, this grant will cover that. And these things are quite expensive when you think of laboratory work, when you think of material needed for case-based surveillance to follow persons. All of this is very important to begin our work.
Okay. And tying everything into one now, we know the discrimination that a lot of persons living with, particularly HIV, face. What encouragement would you give to persons who are listening to this interview or watching this interview in terms of their attitude and approach towards HIV that would aid in supporting the work that you will be doing towards the elimination of the disease?
Great. Well, there are 2 types of discrimination in my mind. First is the self-discrimination. There are persons who are positive and in their mind their lives are over or they will never amount to anything, and that is not so. We have seen persons continue to live a normal life except for the fact that they have to take some pills, they're healthy. And then of course there's a discrimination that you receive from others. Not because someone is sick means that you get to treat them poorly. They are persons, they have human rights and should be treated as human beings.
Okay. So, what else would you like to say to persons?
We want to say that this program that we have for HIV, when we look at the stats, not a lot of people, well maybe half of the people are enrolled in care. At the end of 2015, what I found is that only 335 persons were enrolled in care of the 787 that there should be in care. I know that some of them are seeing private physicians, but at the end of the day, it's under 100. So we still have approximately 200 persons out there who really need to get into the program.
200?
Roughly 200
in St.
persons
Vincent?
who know that they're positive and are not enrolled in care. Right. So we need these persons to come in and to get attention that they need before they get really ill. So that is really where we want persons to pay attention, because they're still coming in very late in this day and age.
And in general, what would you like to say to persons in St. Vincent about their sexual health?
Great. I think a lot of people have gotten complacent in terms of practicing safe sex and sex with one partner. And that has led to not only the rise in the HIV cases, although it's not been much more than other years, but also the rise of other STDs. We have a right to protect ourselves, and we have a right to ask that the other person protect you as their partner as well.
Okay, so what is the incidence of HIV cases in St. Vincent at the moment?
So last year we had 67 new cases. Previous years we run about 65, so it's not outside of the norm, but we should be seeing a decline instead of a stable. We want to see a decline in cases, but that's not happened as yet over the last few years.
So this is pretty essential for us to understand the importance of our sexual health, to acknowledge it, and it's not something to shy away from, especially because the topic of sex, it tends to be a taboo a lot, and so It's not addressed. So we want to encourage persons that with the mandate that the Ministry of Health has been pushing, that our health is a shared responsibility. Your sexual health is a part of that. It's not just about diabetes and hypertension. It's not just about cancer and those other diseases, but your sexual health is very essential, and we want you to take that into consideration and do all you can. Discrimination does not help. Hiding the fact that you may have this illness does not help. Empowerment through knowledge, awareness, and sharing that with others, not the disease, but sharing that knowledge with others is what is essential. Thank you, Dr. Davy, so much for sitting with me.
You're welcome. All right.